Hi, my name is Jiaming Liang. I am an assistant professor at the School of Public Health in San Antonio. November is the Alzheimer's Awareness Month and also the Family Caregivers Month. So this is related to my research, and also I think it's a very important opportunity for us to raise awareness about this disease and also recognize and honor the contributions that the family caregivers did for the society. There are over 6 million older people living with Alzheimer's disease in this country and about 11 million family caregivers. An early diagnosis of Alzheimer's disease is important. So here I want to share with you some early symptoms that you can identify a potential onset of Alzheimer's disease or cognitive impairment. For example, memory loss. If a person is having difficulty remembering the names or the contents of a conversation that they just had recently, or they keep asking the same questions in the same conversation, which could be a significant sign of memory loss. Their abilities of planning, problem solving, and judgment may decline too. And also the language and oral abilities, which means the person may feel difficulty finding the appropriate words in a meaningful and complete sentence and keep using some offensive expressions. That could be a very significant sign of Alzheimer's disease. And also their personality may change, their emotional management ability may decline. We also want to share with you some tools that you can use at home to do some preliminary screening with a person that you love. The AD8 and Mini-Cog are two scales that we use a lot, which are short, usually 3 to 5 minutes, and easy to administer by a family caregiver at home. So that once you get a positive result, you should be more confident to talk to a doctor about what is happening with this person currently. So if you think your family is having Alzheimer's disease or is currently showing some symptoms of cognitive impairment, the very first thing you should do is to seek professional advice. Being a caregiver is very stressful, and it requires a lot of preparation and education. I have 3 suggestions for you. First, you should be mentally prepared to become a caregiver of loved ones with Alzheimer's disease. Always prioritize your own health and well-being. Self-care is important. It is also very important to raise awareness about the disease around your family and your social network, about what is the disease and how it's going to progress and what is going to happen in the future, so that everybody can at the same page and be ready to contribute at some time when it's needed. The third suggestion is to identify the resources available at your community. There are a lot of community-based organizations that provide education resources, intervention programs, and support groups. You can visit alz.org/San Antonio for more information. So during this Alzheimer's Awareness Month and Family Caregivers Month, please don't forget to check on the persons around you with Alzheimer's disease or other relevant dementias and the people who are taking care of them, because they need our support.